What I want most is for partners of commercial fishermen to thrive in this unique lifestyle, and living without pain is definitely a huge part of that. That's why I'm so happy to introduce to you my personal physical therapist, Dr. Colleen Rollo of Paradigm Performance Therapy. In this episode, we discuss the similarities between manual labor and young moms, and how to relieve pain and prevent injury from repetitive movements such as lifting traps, gear, or picking up your cute kids. Or your cute nieces and nephews, if you're like me. We also talk about ways to identify pain and the steps to healing with actionable exercise recommendations from the doctor. And what to do when you're feeling pain but must work through it. I know moms and fishermen know this all too well. Yep, there are so many good nuggets in this one that can help us maintain optimal health so we can continue to enjoy our lives the way we want. Let's dive in. I'm Megan Waldrop, host of the Partners of Commercial Fishermen podcast, an extension of an online community created for partners to connect worldwide, find helpful resources, and share stories to feel less alone in this incredibly unique and adventurous way of life. The POCF podcast invites fishermen, family, friends, supporters, or those curious to know more about the commercial fishing community to join conversations as we learn from each other, laugh, sometimes cry, and relate with those who are the faces behind each catch. What do you say? Let's dive in. Hello, Dr. Colleen Rollo, one of my favorite people and healers of my life, I have to say, because you've really helped me at a time where I didn't know if there was a point of return back in 2022. And I'll get back, I'll go into my backstory a little bit later, but I wanted to welcome you on to our Partners of Commercial Fishing community. And I wanted you to tell us the beginnings of Dr. Colleen and how you got involved in physical therapy and eventually into Paradigm Performance Therapy, which is your business with your husband.
Yes. Well, thank you, Megan, so much for having me. It is such a pleasure to see you in your prime here and doing the things that you do here. So thank you again. I wanted to do something in the medical field, and unbeknownst to me at the time, I could not do anything really medical, if that makes sense. So to be a nurse or to do any shots or anything like that was way off the table for me. So I was playing sports, and I actually hurt my hip when I was a sophomore in high school. And so I had to go to physical therapy. So I was exposed to PT at that point. And I thought, oh, this is medical enough, but it's not overdone where I feel like, oh, I could totally handle that. And so I kind of just fell in love with it. So then you have to go ahead and get your shadowing hours and then apply for school. So right out of the gate, after that one experience, I kind of thought, this is what I'm going to do. And 13 years later, here I am. So who knew?
It's amazing. And then Paradigm Performance Therapy is a business that you started with your husband. When did that start?
We started in October 2021.
And what made you take that leap to go on your own?
So that's kind of a loaded question there. When I was in PT school, Sean, my husband, was just finishing PT school. So when we first started dating, he had said, let's open a business someday. And I said, absolutely not. There's no circumstance that I want to do that. Let's keep business and marriage separate. I have no desire to do that. So a lot of my experience has been in a lot of settings. I've had the pleasure to work in almost every setting except for pediatrics. And that's not really where I wanted to be, but that's just kind of where my situation in life has kind of taken me. And so I just got to a point where no matter what setting I was working in, I just felt like I wasn't giving my patients or clients enough. At the time I was working at an outpatient center and I was having to see 4 people in an hour. And I just felt like I was becoming a dictator. You do this, you do this, you do this. Okay, I'll be right there. And it's just like, I'm not really helping anybody. And it just got really frustrating that I would take home the burden of, oh, I didn't do enough for so-and-so. I didn't do enough for them. It's just the constraints are not there. So there was a situation that happened and I just really was like, I'm ready to throw in the towel. So I called my husband, Sean, at work and I said, tell me why I don't need to leave right now. And he said, leave. I said, that's not really what I was asking for. But it took 10 months for me to kind of decide that, why can't I do it better? Why can't we do it better? Why can't we build a system that can change the way people look at physical therapy? And that kind of was the start of Paradigm Performance Therapy. And it's almost 2.5 years that we've been in business. And honestly, I hate to be lame and say it not only changed my life, but it has saved my life at the same time. So, and I got to meet wonderful people like you. So that's even the better blessing to all of that. So,
Oh, thanks. And I want to shout out that you guys have since moved from your first facility into a new facility within this time span. So that's congratulations on that. I can't wait to see it.
yes, that's right. Thank you so much. Yes, it feels like we're in a mansion compared to the tiny closet that we started off in. So it's kind of a full circle moment right there.
Yeah, that's amazing. And I want to touch base on what you mentioned about how you do something different than the norm of the normal physical therapy procedures that you've been a part of. And one of the things that stood out for me was your personal one-on-one meeting with me, the consultation that I signed up. It was an hour-long sessions, I believe, that we have. And then not only that, the customized exercises that I had that I could change with you at any time. And then also the ability to text you when I needed to. And when I was living in California, since you're located in Wilmington, North Carolina, and I'd be in California for the lobster season when my fisherman was out there doing his thing. It was
Hmm.
so refreshing to know that I could still touch base with you and get updates on how can I tweak this exercise, or do I need to keep doing this, or am I doing it wrong? Because I tend to overdo it. I've
Yeah.
learned in lots of things, but that is one of the things that I really love and stood out about you. And besides that, you're super friendly and you feel like a family friend. So I just want to share that. Also, that y'all don't take insurance. And for some people, that might be a deterrent. For me and my husband, we were stoked about that because we don't even want to deal with all that mess. It was like, okay, we can just pay you up front. I think I paid for 6 classes up front, which was amazing. I could use them within a year and I could schedule them whenever I came back in town and whatever felt good for me. It wasn't regimented or anything like that. So, yes, shout out to the anti-establishment physical therapy business.
I'll be honest, the amount of people that we've been able to help in such a short amount of time has been, I mean, I can't even put words to it. I'm speechless, really, because I can actually spend time with you. And I think that's a lot of the problem. You come 2 to 3 times a week in the traditional model of physical therapy, and I'm spending maybe 15 minutes with you, and then I'm a dictator to everybody else. So I'm not really getting any quality time to understand what your problem is. I'm not really able to spend as much time as I want listening to your specific needs and how it's going to fit into your schedule. And for us, with our business model, we want to make you the driver of your bus, and we're just your crazy co-pilots here. You know, it's unrealistic to expect no exacerbations to pop up, right? We're all active, and that's why we get into these holes, if you will, injuries. And so, teaching you how to fix it on your own, I'm just guiding you along the way. This is your journey. Let's make it the best, and let's get you pain free. And I think the collaboration part of it, right? I agree with you. I say all of our clients are family members, friends that are family. And you took the words right out of my mouth. So it's not like I prepped you to say that. And I really, truly feel that way. And I feel like that makes our model a lot more unique in that respect, where we're trying to be proactive about injuries before they become an injury. Because, working in the reactive healthcare system, you can see where that's bringing us. So changing the script, and I will use our name Paradigm, using a paradigm shift on how people view physical therapy can be insurmountably helpful in so many avenues that people just don't realize.
Man, gold. Love all that. And this goes into, okay, so I wrote a question that says, what services do you offer? And I'm wondering, does that vary between ages, or is there anything that you're restrictive of not being able to work on with somebody?
Off the answer to that quickly, we don't do pelvic floor or pelvic health, unfortunately. But that's a whole specialty in of itself and is very popular and very underutilized. But I also feel like that's changing in the industry now, which is super helpful. So I'll kind of run you through what how to work with me usually looks like. So that can kind of answer what services do I provide. So we do a discovery call with every person before they come into our office so we can get an idea as to what you're dealing with and what's been working, what's not working, what are your goals, and why is now a good time to work on this? And how committed are you to fixing this? So to your point, we don't take insurance, and we've chosen to do that for a variety of reasons, but one of them being I want to find the root cause. And insurance doesn't allow us to do that because they'll cover 2, 3 visits for something that may need way more than that. So we want to work with people that are committed to finding the root cause and knowing that it took time for our bodies to get in the way, the movement patterns that we are. So it's going to take some time to work through that. So we will do your generic physical therapy, right? We do full body assessments, looking at how you move, and then curtailing it to your sport. So I have really loved working with you to curtail your exercises based on your yoga practice. And so we try to make it individualized in that respect of, we both, my husband and I are athletes and we eat, sleep, and breathe that as well. So we like to make it adaptable to your practice and what's important to you. So that's where the services might differ a little bit in terms of your individual exercises. But for the most part, whatever your sport is you're trying to get back to, then that's what we really try to focus out on.
Yes. Okay. And yes, incorporating the yoga was so helpful for me and also got me more excited about creating a morning routine, which I loved doing. So I first went to you because I had the symptoms I felt of carpal tunnel from repetitive typing, doing writer's injury, and I know that a lot of young mothers out there in our communities also have carpal tunnel type symptoms, tennis elbow, any kind of other, sore backs, shoulders, anything. And that's also very similar to what commercial fishermen are experiencing because they also are very repetitive with their motions and lifting heavy weights constantly and all these things like that. And I'm wondering, I know that we're on a podcast, so unfortunately we can't all be on a mat with you right now, which I would love. But if someone is experiencing, let's say, I'm going to throw out tennis elbow, is there a specific, or are there simple steps to help heal that? And what is the protocol for identifying pain and the types of exercises to implement for them?
So it is hard to give a black and white answer to a very vague kind of idea. Tennis elbow can look similarly, but it also can be very individual and different. But if we're going to speak on the general terms of things, new parents, I always say that's the badge of honor. Oh, you got the dad elbow, you got the mom elbow, holding the baby with them on the side. That is all very common. And then with a lot of repetitive stuff that you mentioned. So one, that comes with a load capacity issue. So sometimes if I'm lifting the same amount of weight with a certain posturing over a long period of time, that becomes more of an overuse. So there's an imbalance of some kind. And most of the time, everything is in front of us. So our flexors on the inside of our arms are a lot stronger than the ones on the outside. So we would definitely want to look at your flexibility to see, do you have any flexible restrictions? And then from there, look at your strength deficits. So most of the time, again, there's always an outlier to the rule here, but you want to work on wrist extensor strengthening and work on that eccentric loading. So when you lift your wrist, that would shorten the muscle, and that would be a concentric movement. When you flatten, lengthening the muscle, so that would be an eccentric kind of contraction. So you would most want to do eccentric wrist extensor strengthening, and that usually will kind of get that worked out.
I love that. And this is also very Googleable. If anybody's out there wanting to know more information, you can also Google what Dr. Colleen is saying to get more of an idea of this. Okay, so I'm just going to keep wrapping them off. All right, so
let's go.
But more manual labor questions and mothers, because humans in life, but we're talking about commercial fishermen and mothers mainly. But if you feel the slight pain and you have to work through it because you have to, like you can't get off the boat for another 3 weeks, or you're solo parenting and your partner is going to be gone for another several months or whatever, are there tricks to working with sore or parts of your body? And maybe you've kind of already answered this, but whenever there is, how do you work around these types of, hopefully not to be injuries, but these whispers of pain, we'll call it?
That is a great way to say it. I was going to say, whenever our body's giving us pain, that's a signal whispering something has to change. And whether that be your posture, whether that be changing the way you do it, with fine motor techniques or any fine motor activities, it's hard to change the side of dominance. But to your point, it's easier to do things like massage guns. If people have those available, using a massage gun on the area just to kind of get the muscles to relax. Doing some lacrosse ball or a foam rolling. Foam rolling is hard to do on the upper body, but for the lower body, definitely easier. Lacrosse ball, you can use at different spots to kind of get right at the trigger points. So there are more recovery tools, if you will, easier to manage. When you're actively dealing with pain at that time, you're basically just trying to put the fire up, lessen the symptoms as much as possible. So you could do that with some gentle stretching, gentle isometric strengthening, and then using those other recovery tools, like a foam roller or a lacrosse ball or gentle stretches to kind of help reduce that as much as possible.
Yeah. I like, the lacrosse ball is super easy to pack in a bag to go on a fishing boat. So that would be really great. And I have one from y'all and it's really helpful. And something else that was helpful, I ordered that crazy S looking massager that you can self massage. That thing does wonders. I cannot believe it. Just the knots that I'll have in the back of my back shoulders. I'm like, I don't know if this thing's going to work, and I start working it, moving it around. And I recite your mantra, which I know we'll probably say here, of course, which is,
Yes.
wait, you go ahead and say it. Cause I know you,
Motion is lotion.
that's right. I think motion is lotion because Dr. Colleen taught me that. And I just massage on that thing for a few minutes. And it's amazing how it really does make a difference. Just giving yourself some time.
I have also enjoyed working with you where it has challenged me to find movements that don't require any equipment, if you will, for that point, because sometimes we just don't have the available space or time to go get anything. So I feel like just trying to find ways within your environment to do that has been kind of a fun challenge for me. So I think a lacrosse ball, to your point, can do wonders, or that S trigger point cane, if you will.
Yeah.
I don't really know what the name of it actually is, but basically that. So
Yeah, that's a great point. Okay. I like the cane. That's the S cane.
yes, the S cane.
Yeah. So, okay. So I want to make sure that I have this correct, but whenever your suggest for preventing injury with repetitive movements would be to kind of to look at how you're using your body, number one, and see how you can make adjustments. Two, to see where you are least flexible or where there might be any resistance in your body and work to help with stretching in those areas. Is that correct?
100%.
Okay, perfect. Got that. All right. Moving on down the line because that's how we do it. All right.
I love it.
What are the most common injuries that you're seeing from people in their 30s, 40s, and 50s, and up?
I would say the most common injuries that we're seeing are back issues and or hip. I would say back would be number one, hip sometimes number two. But if I had to sub out hip, I would say shoulder. Definitely shoulder. The shoulder is a very complex joint. It has minimal stability, and we require our muscles to act more of our stability versus the hip. The ball and the socket of the hip is a lot more stable, so you don't need as much stability because the joint itself is. So back and shoulder for sure.
Wow. And so what are people, is it sports injuries? Are they training? What are people getting injured from?
I'd say our younger crew, like in the late 20s, mid 30s, those are more injuries from sport. So I'd say not necessarily CrossFit related, but CrossFit or your overhead functional training or trying to do pull-ups. I would say that's more of where we get the injuries. But again, one size does not fit all. I'd say in our 40s, 50s, 60s, those are more lifestyle injuries where I was bending down to pick up my dog's bowl and my back gave out. And talking to people, it's not that one time that I bent down with terrible form. It's that 1 millionth and one time that I bent down doing similar everyday activities is what sets the kind of the straw that broke the camel's back. So it's more of your posture and your body mechanics that usually are things catching up to us. And that's where your body's telling you, hey, we got to change something here.
Wow. Okay. And then wild card question. Is there I know everybody's different and all those things. Is there one exercise that you wish everybody in the world could do and that would really benefit them that you feel that would be the most beneficial and across the board?
Ooh, that's a good question. That's a really good question. I would say things that we don't ever get, but we need the most. Everything in our world is in front of us. So we spend so much time flexed in a flex type posture. So one mobility and one stretch, I would say, would be a prone press up or cobra, if you will, trying to get that extension. And then I would say the couch stretch, which will help us with our hip and our knee flexibility because again, our hips we're usually sitting and we never get that full hip extension. And so that usually the restriction of the range of motion causes a lot of back discomfort. So those would be, if I had to choose, those would be the two quick ones that I would answer with.
Oh, those are good. Okay. And the first one you mentioned, what would that look like? Like okay, the Cobra, this is what I was going to ask. The Cobra position, are you, and whenever you're in the Cobra form, is it more about the extension or is it more about the shoulders, lifting your chest off the ground? Or is it both? Is it one more important than the other?
So in PT world, it would be a slightly different than my cueing for yoga. So for me, I would say it's all about trying to get the lumbar extension and yes, trying to get my shoulders as far away as possible. But I want to make sure your hips stay flat on the table. So that way you're not in an upward dog position. You want to try to keep your hips flat and then squeezing your glutes to help give your back support as you're pushing your upper body away.
Love it. Oh my gosh. I miss our sessions. I love talking to you about all this stuff. This is how we would talk every session. We're just like going down the list. This is literally how we would be. And lots of jokes and laughter in between, of
Yes,
course.
and I love that too. Like this
Yeah,
is how
yeah.
I thrive. Let's go.
Yeah, awesome, awesome. All right, here's one of my favorites. What does ergonomic mean to you? I've asked you so many times, mainly about my sleeping positions, but I'm also sitting on one of these butt pillow thingies so I can have my extension of my spinal cord. I have blue light reading glasses. I don't know if that's ergonomical, but it's on that vibe. Also wear usually a wrist guard when I'm typing because that helps to that helps me feel more secure in that so I won't get these whispers of pain eventually. So I'm wondering, what are your thoughts on ergonomics, and is it particular to each person, or can you say, hey, try this seat is going to be the best for you, or is it kind of like we all have to kind of figure out which is going to work best?
I think to fully answer that, it largely depends on your job, your profession, and kind of what you do every single day. So, my answer, generally speaking, would be right, we don't want to be sitting in one prolonged static posturing for any amount of time, no matter what that position is sitting, standing, lying flat, in a C curve, right? Repetitive job stuff that definitely piques my interest the most. I remember one time my sister, I was visiting her and she had signed up to go work at a food bank and they were moving stuff on a conveyor belt. And I was there not even 10 minutes lifting those juice bottles, but those were like what, 33? Within 10 minutes, I was like, oh my gosh, my wrists and my arms are so tired. No wonder people that do this for 8 hours a day get injured. And so I feel like for stuff like that, repetitive stuff that you do all the time, trying to find a balance of changing your position so that way I'm not just overusing one side. But I know sometimes that's not possible to do. So it's just trying to be mindful of what your body is doing and keeping the loads, if you're lifting, close to your body and just trying to prevent any excessive pressure in any particular joint, depending on what that movement is. So if you are sitting and typing for a while, right, your ergonomic design would be, is the screen high enough? Am I looking down? Am I rounding while I'm sitting? Is the keyboard too high, right? So you can dictate it depending on what is specific to what your kind of environment dictates. And that can change too. So
Yeah. Yeah, absolutely. And this is making me think because at one point I was so reliant on my wrist guard that I would still get pain. And I realized, oh, because I'm relying on this now. This is just literally a Band-Aid. And so if there are people out there, using back braces and feel like they can't exist without it, you can, and you just have to know the right exercises to help build strength in those areas. Is that correct?
yes, I totally agree. I only usually add bracing in an extreme measure to get people out of pain immediately, but I never want people to rely on it. So if I was wearing a back brace, just to use an example, I'm not using my core at all. And the second I take it off, it's just like I'm a baby that can't hold my head up. I can't control anything. So in the acute phase, it's usually recommended, but not always. And again, it depends. So I usually try to avoid any bracing at all costs. But in the extreme necessity, then yes, of course, if that's in the best interest of the person, it can be helpful.
Okay, I love that. Okay. And then we may have touched on this, but I would love to pick your brain on some more if possible. What are some,
Absolutely.
okay, great. What are some simple stretches that people can do who feel tight or just starting on the journey of incorporating stretches in their life? Because it can feel so intimidating to be like, oh my God. I mean, even as me, someone who really enjoys practicing yoga, when I thought physical therapy, I had the mind block of, do I have enough time to do this? And then I had pain and I thought, oh, I have to have time to do this because I'm in pain. I can't write. I can't pick up my nephews like I want to. So if there's somebody who wants to get started, and not sure if they have the time or can do this right now, what simple stretches do you recommend?
That's also a good question. So usually when people ask this, I struggle to keep it minimal, but again, I want to make it useful for your time. If you have 10 minutes that you can dedicate, let's make it work. So I could go crazy and give you 30, but let's be realistic. I, as a PT, I'm not going to go do 30 different exercises. So sometimes less is more. I do feel like people in society, I guess not people, society is trigger happy with the word stretching, flexible, where I feel like it is good, but sometimes we just don't need the stretch. Like I remember when we were working together, like we need to strengthen, we don't need to stretch. You've stretched and then some. So I go on this long rant to say stretching is not always the answer, but for some people that don't do a lot of physical activity involved in their job, stretching could be a good supplement there. So, one big one that I would say would be helpful for probably anyone, unless you're a gymnast or a dancer, is a standing pec stretch in the doorway. So, you can use both arms on the outside of the door, step forward, leaning in, and you'll feel that pretty strongly on the front side of your body. I love that stretch. A figure four stretch for your glutes. So if you're lying flat on your back and you cross one leg over and you're bringing it up, you should feel that pretty strongly in the glutes. That is a super helpful stretch as well. You have mentioned tennis elbow, so I feel obligated to add in some of those as well because that is very common. Usually I like to do a short stretch. So you bend your elbow and everyone always forgets the thumb. So don't forget the thumb, the hands and the fingers all together. And then I'm just bringing my hand towards my elbow, short. And then you do the same thing, but straighten the elbow with your arm straight, same thing. And then doing the wrist extensors. So I would straighten my arm and then my thumb is towards my center. I'm going to bring my hand away and then pull my fingers back. So you feel a nice strong stretch up at the top. Now, gold standard for stretching is technically 4 sets of 60 seconds. Now, the average person likely stretches for 20 seconds at best. So I usually say 3 sets of 30 seconds is better than nothing. So
I love that. And okay, so what about the double jointed peeps out there? I'm one of them. Whenever we're doing these extensions, do we have a slight bend in the elbow so it's not completely over extended?
So for double jointed, I would rarely ask you to do any stretching. I would say we need to stabilize a little bit more than stretching. So I would probably not even recommend doing stretches because you could overstretch where you don't feel anything. And you're like, I just don't feel it. And even if you do modify, like you suggested, I just don't think the juice is worth the squeeze there. So I would rather work on strengthening with you, which could be where you have an impairment there, but it's feeling like it needs to be stretched.
Yeah, interesting. So if people want to learn about strengthening, they need basically, I mean, the answer to everything is to contact a physical therapist, Dr. Colleen, but just to contact you to say, because you don't know what is connecting to which that you need strengthening is. I think that's what really kind of blew my mind when I was talking with you because my wrist hurt, but we ended up finding out that it was really my shoulder muscle that I needed to work and develop that whole part of my arm. It wasn't just my wrist. That was just one of the screaming, or it wasn't just tennis elbow. It was so much deeper than that. So if people
Yes.
want to learn more about their body, are we able to connect with you virtually to do that? What's the best way that people can do that?
Absolutely. Yes. We love to do virtual. We obviously love to do in person as it allows, but virtual can be super helpful as well. So I would recommend people hitting our website and you can send an inquiry there. But we also have the availability on our website to schedule yourself an appointment. So we have both options.
Awesome. And it's paradigmperformancetherapy.com. And I'll put that in our show notes. And another thing that I really love that I feel like is a gift that keeps on giving is your newsletter. I get them, we get them every week. And the most recent one was preventing text neck, which I love and also am terrified of in its own way. But you called it, I love how you put it. You said you're taking care of your bowling ball, which is your head. And you show pictures of people leaning forward in varying degrees, like if you're looking at your phone. And it was so interesting to see, okay, this degree, this how much, and just realizing how much pressure we are putting on our neck. So how can people connect with your newsletter to get all this juiciness every week?
I would say you can definitely go back to our website and just fill out the form and then just add in the comment section. Would love to be added to your newsletter. I love that email too. I am such a nerd that I tell that to people all the time. Every 5 degrees forward, your head is in front of your body is an extra gallon of milk's weight on the neck. So you can imagine if you're slouching, how much pressure is added to that lower back. We could nerd out for hours, but yes, I love that.
Wow. I mean, yeah, and our spine is everything. Like that is what keeps us together. And it's incredible to think just like looking down a certain way is going to affect the entire part of that. Wow.
Right. Yep. It
Okay.
all starts from the brain and spinal cord and then it works its way down. So yeah, it's
Wow.
crazy.
The human body. And the thing
It,
is, we get older, our bodies are going to deteriorate because that's what happens as being humans. And it's, the bittersweetness of life. However, it doesn't mean that when you reach a certain age, you can't get strength or you can't gain flexibility, which I think is really important because I feel that maybe even our generation and there's a new understanding, maybe it's just a new understanding of the human body where it's not, well, I'm this age and I'm just gonna hang up my boots. And it's like, no, you don't have to deal with pain for the rest of your life. You can actually help yourself and your body can get stronger even if you are getting older. It can be in better shape than you were in your 20s and 30s, which that's how I feel, honestly. But it's so important. Physical therapy, I love it. And it's the thing about physical therapy is you have to do the exercises to see the results. I mean, it's all on you. It really is. I mean, you can
mhm.
have the tools. Dr. Colleen can give you the keys to the kingdom, but you got to use the keys. And whenever you're able to make that part of your daily routine, it changes the world. I mean, just in a few days, I feel like you can notice, a difference and,
Oh
you know,
yeah.
make it a vibe. I would light candles. I had music going. I had incense. Like I made it a thing every morning. It was my thing to myself that I was going to get out of this pain.
I love
Yeah.
that. I think
Yeah.
that makes it more special too, and that makes it more meaningful to you. And that's why making it individualized is so important. But I found this article and it was talking about how the body has a use it or lose it policy. And I do feel that we as a society are very much like that. We don't use all of the body's capabilities. And we are so resilient and we do beat it up when we're younger, but the body has the capability of healing itself. You just need to know what to do. And to your point, sometimes it's just there's too much information out there and you don't know what to start with or how to start. So having some kind of plan definitely makes it important, but to have your own little vibe and setup, I love that. That's great.
Yeah. Yeah. And to have a physical therapist that isn't just rushing you through because you're part of the insurance checklist. Like to actually have somebody that's like, how are you feeling? I mean, even mental health wise, I mean, we would talk about all kinds of stuff and very personal, but also extremely helpful. And I feel like, yeah, I can't say enough about you. So I'm so happy that you've been here to share with us. And I would love to know from your 2.5 years, and you've said so many great aspects about your business, but what do you feel that makes you stand out from maybe other independent therapists out there?
That's also a good question. What makes us stand out more than other therapists? I think our business model speaks volumes to this question is be a human first, right? We all have stuff that we're dealing with. We all are going through something, and it's just trying to meet you where you're at and understand you so that way you feel validated, you feel heard, you feel understood. And then just connecting those dots and all of the facets that life brings us, I feel like definitely sets us apart.
I love it. Well, thank you so much for being here. And any of these helpful notes I'm going to put into the show notes for our podcast. But thank you so much, Dr. Colleen. And I just wish you the best. And I can't wait to see your facility soon.
I can't wait to show it off for you. And thank you so much for having me. I'm so grateful.
Thank you so much for being here. Your downloads, your reviews mean more than you know, because that's how we know that you are enjoying the podcast. And if you'd like to further support the community, you can tap the subscribe button, share with family and friends, post on socials, or write a review. But you know what? As long as you're getting value, that is all that matters. But if you go that extra step, we truly, truly appreciate it. So thank you, thank you, thank you. And if you're a partner of a commercial fisherman looking for more resources on how to navigate this unique lifestyle, from long distance dating to communication to finances to motherhood advice to mental health, safety, you know, all the things. We're building more resources on succession planning and retirement. It's going to be amazing. There's even an option to join the private forum as well if you jump onto POCFpride.com to learn more. We are there for you. We got all of the community and all of the resources you need, and they are continuing to grow as we learn what you need the most. We can't wait to connect with you, and thank you so much again for being here. Thanks for listening today. Being here means you're a part of the POCF family, and we wouldn't be a community without you. I'm Megan, and this is the Partners of Commercial Fishermen podcast. As always, much love, POCF pride, and remember, you are not alone.